plastic surgery. And then, you know, the other side, the kind of some of us think it's still taboo. Some of us are open about it. So injectables. And we're going to talk today. We're going to debunk a lot of myths about these injectables. You know, there's no judgment-free zone here. I have a bunch of questions that I sourced from you guys last week. And this is interactive, so please feel free to ask questions while we are live. And we'll do our best to answer those. But we do have, I think that all the questions we have today are going to cover everything. So I'm just waiting for them to get on. We'll just give him another minute. He's so generous with his time and giving us this full hour. I can't imagine how busy he is. I mean, I know I had a full day. I literally just finished working. So been working since 8 a.m. this morning. But I always have time to talk about injectables. How's everybody doing? Thank you for coming. Love it. So, hi guys. Here we go. So, Dr. Abraham he owns the practice in Poughkeepsie, New York, which is local to me. I live in the Hudson Valley. It is called Oasis Medi Spa, and I actually have a friend that works there as well. She's one of the lead estheticians there, and I've been going there for some treatments. It was a beautiful birthday gift from my husband. You know, when you reach a certain age, you like to, you know, sometimes moisturizer doesn't always do the job. So, you know, and I'm open about it. So yes, there we are. Okay, so they're on. Let's go live. Okay, for some reason, can you request to be in my live? Because for some reason, it won't let me ask you. So you should have a pop-up where it says request to be in my live. And hopefully that will work because yeah. Oh, it says New York Face MD must upgrade the app in order to join. So you guys have to upgrade your app. Hi, everyone. Yes, they'll be right back. So in the meantime, let's talk about how everybody's doing. How is everyone? Hello, hello, hello. How's everybody doing here in New York? It's been snowing for, I don't know, 4,500 days, it feels like. The other day I was talking to someone, it was my sister-in-law. She said she heard on the radio someone say that it feels like we're in a snow globe and that a child is just randomly shaking it whenever they feel like it. And that's literally what it's been like for the last, 7 days. It's been a while. We've had pretty mild winters. So this is kind of like not really great for me. I hate the winter. For anyone that knows me, I love the summer. I see here we have so many people in the house. Hi, Steph. So like I said before, if you're just joining, we're going to have a Q&A session with Dr. Abraham from, here we go. They got it.
Hallelujah.
Hello, we made it.
Hi, Christina. How are you?
I'm well. How are you doing?
Good. Sorry about the technical difficulties. I guess we
Oh my God. It's okay. Hey, technology, but at least we're out of Mercury retrograde, which I heard was yesterday. So we're past that. So we're good. That was actually pretty fast. I mean, thank you for giving
technology. Here we are. You know, you're sitting at home, I'm sitting at my office, and we're connecting with all these people. It's kind of cool, actually.
Isn't that amazing? Like, it's 2021, right? I always say, like, even though the pandemic has had obviously a ton of negative, aspects to it, but it's also brought a lot of us together. We've found some new solutions to like coming together, right? And still reaching large amounts of people. So that's really awesome. I'm so excited. Thank you, by the way, for your time. I know that you're a busy man. When I
But
posted this on a few different of my social handles, people were saying, oh, he's like a local celebrity. He's the best. The ladies love him in the Hudson Valley. So thank you so much.
I
This is a
love it.
great.
Keeping everybody looking great. That's our motto.
That's right. That's right. So today we are going to debunk a lot of myths and we're going to get some information, right? So, like, of course, I'm a beauty expert. I work for MAC Cosmetics. I'm all about, what makeup can do, the skincare, what that can do. But sometimes skincare maybe isn't enough, or you just want that extra little push, right? And sometimes also, in having conversations with women, they're either shy to talk about injectables, right? There might be a little taboo tied to it. Shouldn't be that way. So today we're going to debunk all these myths. We're going to talk about safety. We're going to get rid of anybody's fear and just show everyone that it's okay. No judgment, right? Whatever makes you feel beautiful.
I love it.
And
And I got
and
to say, Christina, the nice thing is that these are, it's almost like instant gratification because, obviously you can do some of the other treatments which will give you great improvement, and skincare, obviously you got to do that. That's kind of the basics. But
of
doing
course.
a little bit extra gets you a little bit more of an improvement, and having that instant gratification, I think, is always very nice. And I really am glad that you have this topic in mind, because a lot of people do have misconceptions about what these treatments are about. So I'm glad we're able to discuss that.
Yes, I mean we can thank obviously TV and media, right? You see some TV shows where like you're just like, oh my God, no, that's not true. That's not what it's all about. So I'm so happy we have this moment together. I'm really passionate about these topics. So and you're one of the best. So I'm so happy. So last week I sourced questions from my followers, my viewers. So we have a whole list of things to go through. So I think we should just get right into it. First of all, tell me about yourself. Tell me about like who you are, how long you've been practicing. Just give us a little bio.
Absolutely. So I am a double board certified facial plastic and reconstructive surgeon, meaning that I only specialize in the face, in the head and neck. My practice really specializes in cosmetic treatments, but I also do reconstructive, really complex microvascular, complex reconstructive procedures. And what that really means is that I really bring everything to the table. So there's nothing within the head and neck that I can't handle, but I love taking care of cosmetic patients. It really helps bring out the best in people, right? If you can make them feel good about the way they look, they're happy, and that applies to not only the reconstructive work that I do, but clearly the cosmetic work. So I love taking care of patients. Now, I've been in practice here in the Hudson Valley for almost 20 years. And prior to that time, I trained at Cornell, at NYU, at UCLA, kind of top places for plastic surgery. I think what I really love about being here in the Hudson Valley is I'm able to bring that expertise right to our backyard here in the Hudson Valley. I love it. So, I'm glad to be able to be here for our clients and patients here.
I love it. Yes. And we love that you're here. And also, I wanted to mention that we are giving away something during this live, right? Do you want to tell us a little bit about it to one lucky viewer? So
That's exactly
I
right.
was so generous.
On someone's spot. So if you're the lucky person, we'll set you up for that treatment. And I know, Christina, you know about it, so you'll give us a little bit more of a preview of that when the time comes. But
Yes.
clearly, there's going to be a lucky winner at the end of tonight.
I love it. I love it. And even if you don't live in the Hudson Valley, it's worth to drive. You can do a virtual consult first, and then you can come on up and talk to him because it's worth the drive, especially when you're going to someone who knows what they're doing and who is, an actual doctor. That's the other thing. So, all right. So let's start with the first question. Okay. So my audience wants to know, what is the difference between Botox and filler, and what are they made of?
So that's a great question. A lot of people, don't know the difference, and it's certainly worthwhile talking about. So Botox is a medication that relaxes hyperactive muscles. Okay, so let's take a look at your forehead, for instance. You've got muscles there that create movement, that allow you to move your eyebrows and have some of the expressions that you do in between your eyebrows as well. But the problem with those frown lines is that over a period of time, you start to see these lines and creases that are left over. So Botox helps relax those hyperactive muscles that are causing the lines. So anything that's dynamic or movement related created by muscle activity, we can actually relax with Botox. And so that works really well. The fillers fill. I mean, it's right in the name, right? So if you've
Mm-hmm.
got a crease, let's say your folds or the corners of your mouth, your lips, your cheeks, which lose volume as you get older, unfortunately, and things start to deflate, then coming in and filling, I like natural products for that as well. If you use those natural fillers, you can restore the volume that you've lost in these particular areas. So they serve two different purposes. The Botox is a good way to naturally relax some of the hyperactive movements in your face so that those lines go away. And the filler works to fill some of the volume that you've lost. Now, that could be lines and creases as well, but it's usually more for volumization of your lips and your cheeks and other things that we can create kind of natural, youthful volume.
Right, natural. And that's the one thing I want to say too about you that I know about you is that you always aim for natural, right? That's your goal.
Absolutely.
Rejuvenated.
These who are overdone, and that's kind of the bane of my existence, really, because people come in and they don't want to look artificial. They don't want to look overdone. And if you really, pump a bunch of filler in there without knowing exactly what you're doing, then you could end up having it look artificial. And that's certainly not my goal. I want it to look natural. I'd prefer somebody to come up to one of my patients and say, "Oh, wow, you've been to the spa, you've had some skincare, you've gone to Christina to get skincare," as opposed to having them say, "Oh man, I can tell you've had something done, you've had a lot of filler put in." That's not the goal. We want it to look nice and natural. And if you use the right techniques and you have the right eye, that's certainly something that we can achieve.
I love it. Okay, so another big question, and I hear this a lot, right? Even amongst my friends, and they ask, will I look botched? And what if I don't like it? So you
Right.
kind of talked about the botched part, right? Which we know your goal is always to look natural. But what happens if someone comes in and they don't like it? For me,
Well,
I think that's like
so certainly in my hands, again, we're trying to avoid the botched.
right.
That would be a good first step. But the nice thing about some of these fillers, and the Botox as well, by the way, so the fillers are reversible, at least the ones that I use in general. They're made up of something called hyaluronic acid, which is a natural product found in your skin and in your joints. So it's not anything artificial that we're putting in. So it integrates them, becomes a part of your skin, which is great. But the nice thing about those hyaluronic acid fillers is if for whatever reason you don't like the way it looks, there's another enzyme I can inject which makes those fillers dissolve 100% and has them go away. So it's a really nice safety outlet, a nice safety valve. And for anybody who's concerned, especially if you haven't had it for the first time, it's nice to know that, look, if I don't like the way it feels, it looks, I can get it to go away 100%. Now, Botox also kind of fits in that same bucket because it's not reversible, but it doesn't last forever. Okay, so the first time you put the Botox in, as you may know, it typically lasts about 3 or 4 months. Now, that's good news and bad news, right? Because it doesn't last forever. But really, the good news, especially if you're trying it for the first time, you know that if you don't like the way it looks, that effect will not be permanent. It'll start to go away. And so after about 3 or 4 months, if you've had a problem with it, that effect has completely gone away. Now, again, if you go to the right person, you shouldn't have a problem the first time. But if you
Exactly.
do, again, there's a nice safety valve. Now, what I tell patients about the Botox, if you really like the way it looks, and guess what? Pretty much everybody who comes to me likes the way it looks, is you do want to get yourself into a little bit of a maintenance routine, which is initially it lasts about 3 or 4 months. If you come back before the effect has completely worn off, the next time you'll actually get a little additional time out of it. That's because the little muscle fiber that's causing the problem will start to weaken a little bit. It's like not going to the gym, right? So that way we can
Yep.
stretch out how long that medication lasts. So the Botox the second time will last probably 4 or 5 months. The time after that, maybe 5 or 6 months. So we can really stretch out how long it lasts for you. So you're coming back maybe a couple of times a year to get a little shot of Botox, and that prevents the lines from coming back.
That's amazing. Yes, I agree that when you try, even for the first timers, you try it, you're gonna love it. You're gonna love it without a doubt. All right. And then another question is, which I had this question myself too. What age is the right age to start Botox? If I'm under 40, can I get it?
So that's an excellent question, by the way, and it really depends on your attitude. So I really love the concept of maintenance and starting early and preventing lines from getting going. So we start patients with Botox while they're in their 20s, believe it or not. The frown line, for instance, is a place that usually starts to bother people relatively early. And if you get in there early and you relax those muscles before they really start to crease your skin in and leave these permanent indentations, then you can keep those lines from ever forming. So, being prophylactic and being good about maintenance is definitely one way to go. Now, you can certainly do this afterwards. If you come in a little later and some of those lines are a little deeper, we do have options in terms of how we can correct the lines for you. But there's no downside to being prophylactic and starting a little earlier as opposed to later with a lot of these treatments.
I love it. And we have some comments here. I have Taylor who said she loves Botox. She started at 26. And then Nostrano Vineyards, she started at 28. So
Yeah.
see, it's never too early. Preventative is always better, right?
I really like that concept. I'll tell you, some of this is an East Coast, West Coast kind of a difference because I spent a lot of time out in California, and people there really do start early. And I think as a result, they kind of maintain themselves over a long period of time. I think in the East Coast, people tend to kind of hunker down. We have our cold winters, and so you kind of hunker down over a period of time. And then when they come in, they've got a lot more going on, so it's a little bit more difficult to get it under control. But if you have any young viewers out there right now, I would certainly recommend. I mean, you don't have to go to town. It's just a little bit of Botox every once in a while.
Right.
Good way of kind of getting yourself into a good maintenance routine to keep yourself looking good in the long haul.
Love it. I love it. So the next question is it painful and is there downtime?
Also great questions. So in my hands, really, I don't like patients to be uncomfortable. So I do everything I can to minimize the amount of discomfort. So we do a few different things. One is we always put a little bit of topical numbing medication on, which takes the edge away. So we let that sit, for 5-10 minutes. It kind of gets into the skin and takes that initial sensitivity away, which is useful. And the other things that we do, there's a really interesting tool that I use in my office. It's actually a little vibration device. It vibrates the skin. So we put that right on the skin next to where I'll be doing the injection itself. And guess what? Your nerves feel the vibration and they don't really feel the needle pinching quite so much. So that's a great technique. It's called gating because you're gating the nerves to only feel the vibration as opposed to the pinching of the needle. With the fillers, believe it or not, now the fillers actually come built in with a little bit of numbing medication as well, so that once the needle goes in and that numbing medication gets in there, it actually numbs that area completely. So that makes the discomfort much more tolerable because after that initial first pinch, it gets numb and you don't feel it anymore. And then the final two things, I love talk aesthesia. So talk aesthesia is if I can get you talking about something else and get your mind off of what we're doing. Obviously that's great. You're thinking about something else, and then 5 minutes later you look beautiful, right? So I think that's a good way to go. We've got a little squeezy, a little stress ball that we give you as well. So and ice and other things. So you put all of that together. Really, the treatments are very, very comfortable. For people who really are kind of freaked out about treatments, I've got a little Valium in my back pocket. So
Okay, right.
just give you a little prescription to kind of take the edge off if you want. You need a ride, obviously, if you're going to have a little Valium. And then we also have Pronox, which is laughing gas in our office. So again, there's a lot of different things that I do to try to get you as comfortable as possible because I don't want pain to be the limiting factor in you looking to get the treatment that you want.
It's definitely not. So thank you for sharing all of that information. Okay, so we talked about how long it lasts. So the other thing too that I get a lot, that a lot of the questions, because these are just, I've received a lot of questions, but I kind of like sum them up into the ones I sent Marissa, right? So changing of the appearance. So a lot of the time someone won't try it because they're scared they're going to look different, right? So what do you tell a patient that comes in and says, I'm scared to look different? Just because, again, we have YouTube, series on TV called Botched, where they show you all of the worst case scenarios of people that go overboard, right? So what do you tell a patient that says, will I look different?
Well, speaking of Bosch, by the way, Paul Nassif, I knew Paul when I was out in California, and he's
All
good.
right.
And he does a lot of great work, but again, the idea is not to end up in a botched situation, right? I think if you go to the right person and you get things done, then the goal is to get you looking as good as we can and keeping you looking natural, so that there's no need to do any corrective kind of work. All right, so in terms of the specific look that is best for each person, really it's a personal choice, and what may look good on one person may not look like that person wants in somebody else. And so I always like to sit face to face with someone, or again, certainly with these online consultations as well. I'm able to kind of get an idea of what the patient is looking for. Most people do want to just turn the clock back, especially if they're a little older. They're just looking to revolumize their face, for instance, or get rid of lines that they didn't have when they were younger. So that's a pretty easy way to get there. But there are some people who come in who just want, a little bit more plumpness to their lips, specific lip shapes that we can look at. I always like the idea of looking at photographs that they have of other people that they may like the anatomy, and that way we can kind of come up with a game plan in terms of what we're trying to achieve. I think the bottom line again is any result is achievable as long as I have a good idea what the patient is looking for, and we're on the same page about, well, that's a reasonable look and you'll be happy with it. And again, in my back pocket, I have this safety, which is if you don't like the way it looks for whatever reason, I can just dissolve that filler and have it go away. So there's no risk in trying something, because we can always get it back to the way it used to be if we need to. That's the beauty of these newer fillers, which are really very versatile. And I think in the right hands, you really can't go wrong.
Right. Have you ever had to tell a patient, like, no, we're going to do it this way? Like, I don't recommend this. Like, have you ever been in a situation where you're like, I really don't recommend this. Let's start here.
Yeah, so that's an interesting question. So obviously, when I'm talking to patients in general, I do want to make sure that they have the right goals, right? So there is a particular condition called body dysmorphic disorder. I'm not sure if you're familiar with it. It's called BDD.
Yes.
Where no matter what you do, the person's not going to be happy with the way they look. And so you have to be careful in that situation. Obviously, we want the patient to be happy. We want the patient to get a nice result and be happy with the result. And so, if you get into a situation where it's not really going to get them to that final goal of being happy, then really it's not worthwhile doing that procedure. So, I don't think I've ever said absolutely no unless I know it's going to be a problem. Because like I said, a lot of these treatments are reversible. And so especially for things like fillers and Botox, which are very safe in that fashion, I don't think you can really go wrong. But it helps to go to somebody who knows what they're doing so they can get you that end result. We should talk a little bit about things that could potentially go wrong, even though fillers and Botox are very, very safe treatments. Again, I think you need to go to the right people to get the right result. And if you do that, again, since I know that they're reversible and I can fix certain issues, I don't think you would ever have a problem.
And I think this is a great transition into the next question, which is, are all injectors created equal? Like, when you go, if I come to you or if I come to someone else in your practice, like, is it like how it's just Botox, right? Like, or is it? Right? So is it all in the hands of the injector, or is it all in the hands of the product?
That's an excellent, excellent question. Now you have to have great products. Okay, so Botox is a fantastic product. There's an equivalent, by the way, something called Dysport, which also works well. Coca Pepsi. There's a couple of new ones, Bo and Xeomin and others as well, which, again, we could spend some time talking about if you guys have questions. But, again, you need a great product, and Botox is certainly a great product. And a lot of the fillers are great products. So Voluma and Juvederm and Restylane, I mean, there's, a lot of them. So certainly the quality of the product is important. But I would absolutely 100% agree with you that the quality of the injector plays a huge role on if you're going to be ultimately happy with the result. And let's talk about that. So you can break down the quality of the injector into a few different criteria, right? So the first thing is training. Has this person gotten good training? You know, have they gotten more than a 3-day course that they've gone to where they've seen a bunch of people be injected and now they're injecting, right? So you got to be a little careful about that, because unfortunately in our community sometimes you have spas and other things that pop up where they're just kind of reeling people in, and you really do have to ask about qualifications. So the training, and specifically board certification, if you're board certified in plastic surgery or dermatology, facial plastic surgery, then you know that these people have had training, and it's rigorous training. You're talking about a couple of decades worth of training, understanding the anatomy of the face and understanding the anatomy of the blood vessels and the tissues. All of that's really critical, because if you don't know what you're doing, you could potentially have a problem. We can certainly talk about what that means. The second part of this here is, do you have the training? Do you have the experience, right? So, if you go to somebody who is fresh out of training, brand spanking new, now, that person may be great, and we'll talk about that because that's the final element. But, if they haven't been doing this for at least a few years, and, again, I've been doing this for 20 plus years, then they haven't had the experience. They haven't built up the volume to really be comfortable handling every possible situation, right? So I think having the experience certainly plays a role as well.
Yeah.
And then the final part really is this artistic eye, which is, you could go to...
It is an art, right?
It is. It absolutely is. And there are plastic surgeons, who get great results, and there are plastic surgeons who technically may be great and maybe have all the knowledge, but for whatever reason, it just doesn't work out. And so I think going to somebody, one, who's board certified, who has the training, going to somebody who's got the experience and has done this for more than a few years, and then going to somebody who's got a good eye and, it can get you the results that you're looking for, all of those are important. And if you put that all together, then obviously you'll end up in somebody with good hands, and you'll be happy with your results.
I love it. Great answer. So for those of you just joining, I'm here with Dr. Abraham from Oasis Medi Spa. He's a board certified plastic surgeon.
Facial plastic surgeon. So
facial, that's right. Specialized face and neck.
That's right. I'm not a jack of all trades. I'm not doing tummies and boobs and everything else. I've got other
right. You're just doing face and neck. Exactly. And that's why it's great to go to someone like you for injectables, because that's all you do. Right. So I love that. And if you're on this live, stay tuned. I would stay till the end, because we are giving away, or actually Dr. Abraham is generously giving away, a Botox treatment to one lucky viewer. So you don't want to leave. Okay. So let's see. What's another great question here? Oh, yes. Okay. So liquid rhinoplasty. This was a question that came up. One of my followers, actually, he's actually one of my artists. I train him. And he really wanted to know about liquid rhinoplasty.
Right.
So like a nose job without the surgery.
You got it. With an injection, right? Believe it or not, you can actually now get a structural change to the shape of the nose with just an injection. And really it is cutting edge and new stuff, because even 5 years ago, maybe even 3 years ago, nobody was aware, or nobody had really perfected this technique. And so it wasn't really commonplace. And you'd have to go under the knife to get, a rhinoplasty type result. So the way liquid rhinoplasty works is that you need to put that filler in very specific places in the nose in order to get the result that you're looking for. So a great example is somebody who's got a bump on their nose and they don't like the way the bump looks. If we put a little filler above the bump and maybe a touch below, we can camouflage that bump so that you don't really see the bump anymore. And that's really a great, simple, 5-minute procedure in the office to get that structural correction. It also works for the tip. You got to be a little bit more careful. Again, the tip's got more blood supply, so you need to know where to put that needle so that you don't have a problem, but you can get a little bit of a lift to the tip. And if the nose is a little crooked, if it's a little twisted one way or the other, if I put a little bit more filler on the side, that's where it's pushed in, I can get the nose to line up a little bit better. So again, there's specific techniques that I use to try to get that result for the patient. Now, there's pluses and minuses with liquid rhinoplasty. So the big downside, again, is that it's not permanent. So fillers in general will last about a year and a half. Maybe 2, and then you need a little bit of additional correction going on down the line. But it's a good way to kind of get a taste of what the nose will look like. And then if you really like that look, we can always talk about a rhinoplasty, a permanent correction for you down the line. But if you're not sure, I think these techniques like liquid rhinoplasties are great options because they're really simple, quick in and out procedures where you get a permanent structural change, with a 5 or 10 minute procedure.
That is so fascinating. I had no idea. I actually, yes, someone here, Makeup Art Unites, they say you're an artist with faces. Yes, we actually just said that you have to, it is an art, right? Because you're dealing with someone's facial structure, their features. Where do you enhance? Where do you, recede? Where do you make, like you have to know these things in order to really provide an exceptional result. Right? Which,
yeah, and I think you and I are exactly in the same field because as an artist yourself, right? As a makeup artist, you need to understand the contours of the face, what to highlight, what to fade, what to do in order to get that particular shape. So obviously we work in collaboration. Marissa at my office and all our estheticians here, they do
yes.
a wonderful job as well. And I really, I like this concept at my office of bringing all of the specialists together. So we have estheticians, we have eye plastic surgeons. I'm a facial plastic surgeon. We have a body plastic surgeon. I teach, so I have my fellow from Mount Sinai, and my residents come up here. And really, it's a big collaborative effort because when you have all of that expertise together, then we can really do whatever we need to get the patient taken care of. And that's ultimately what it is that we want to make sure that the patient and the clients get the results that they're looking for.
And someone here saying Marissa is the best, and I agree, Marissa is the best.
I see all those hearts.
Yes. She is totally the best. We're going to talk about Marissa and like some of the treatments, like towards the end of this, but I saw someone asked about, let me see if I can find the question. Oop, okay. Are we there still? Yes. So someone asked about lip threads in general. Are they good or are they not?
Yeah, so Marissa and I we were discussing this topic because it's interesting. Threads now, the new version of the threads, which are these dissolvable threads, are kind of in vogue. And
like, what is it anyway? I have no idea. What is it?
So threads they've got tiny little barbs on them, and they're essentially a suture with tiny little barbs so that when you pass it through the skin and you pull up on it, it tends to grab the tissue and it pulls things up. Okay, so it's kind of a self-retaining. It's almost like tape, right? If you put it through the skin and you pull it up, it holds its shape. It kind of pulls. So here's my perspective on threads, which is everything goes around in circles, unfortunately, right? So going back about 10, maybe even 15 years ago, these barb sutures first came out. And I used them back in the day as well. And the problem we had back in the day, about 15 years ago, 10 or 15 years ago, is that we had some issues with something called railroad tracking, which is when you pass the skin, the suture through the skin, it would grab the skin and you would leave these little indentations in the skin, which didn't look great. And they were permanent sutures back in the day. So the other problem that we had is that, these sutures could sometimes come out through the skin and you could see puckers and, sutures could potentially extrude. Now, if they were done the right way, they still worked out. And so, we were using them for a while. But then the problem that we finally realized was because they passed through the skin over a period of time, guess what? Skin's a little stretchy, and it tends to kind of stretch beyond what the thread would do, and so the result would last for maybe a year or two and then would go away. And back in the day when we were doing these procedures, they were pretty expensive, so it didn't seem like it was much of a bang for the buck. Now that's 10 years ago. So
Right.
now the manufacturers of these threads have realized, well, so permanent sutures aren't working well. Maybe if we make them temporary, maybe if we make them dissolvable so that they don't extrude through the skin, that will be a better kind of a quick fix solution. And that's kind of what they're pushing right now, which is that, you can pass it through the skin, pass it through the lip, or pass it through your forehead to lift up your eyebrows, and it will temporarily lift those areas. You can actually get a little volume since you're using, it's kind of like putting a little filler there. You're getting a little volume from that thread as well. But the big thing to understand with threads is that, especially because they're dissolvable, the result is not permanent. Will typically last for about a year or two and then go away. Now, there is certainly a role for that in a patient who's maybe looking for that kind of temporary improvement. It's kind of like fillers, right? I mean, the fillers you put in there for a year and a half or two, and then it goes away, and you got to go back in and do some more. So I think in the right hands for the right client, the right patient, it works, but it's not something that necessarily gives you a permanent lift. And so I don't like it when people come in looking for a thread lift as a permanent solution for their concerns, because it really isn't. And you need to understand that, especially for places that move a lot. So, for your lips or for your forehead, there's a lot of movement going on
Yeah.
there. And unless you're putting a little Botox in there to kind of relax some of that movement, then the thread really will kind of just work its way through, and it's not going to last for more than a few months. And so you have to be a little careful to make sure that you know what you're getting out of that procedure.
Love it. So informative. I have another question. So someone said about the Russian lip filler technique. Are you aware of that? Have you ever heard of that? I've never heard of that. If it's still safe.
The Russian. Now, there's a lot of different ways to lip. I haven't heard the Russian term.
I haven't either.
Most people talk about kind of a linear threading technique, which is useful. So, again, if we're looking to line the shape of the lip, remember there's that nice Cupid's bow shape to the lip. And if you're looking for just a little bit of a pout, then putting a little bit of a line of filler around the lip works really well. Then we actually volumize the lip, which is where we're kind of giving you a little bit more volume. There's something that's really kind of popular now called the keyhole lip look, where you create a little bit of an opening in the middle of the lip, kind of like a little pout, by putting the volume in the right places to the lip, and that works as well. And then there are different techniques where we can come actually in from the outside of the lip to kind of get the lip to furl up a little bit to give you a little bit more of a pout. So there's a lot of different technical ways of addressing the lip. Again, I haven't heard that term Russian before. I'd be a little cautious of that. That maybe is being done just in Russia, but
yeah.
I've more about it because I haven't heard that term.
Well, if you haven't heard about it, then we are not going to even talk about it. Okay. I mean, nothing against the Russians. They're all beautiful and they come up with these beautiful techniques, but
Russian patients that I take care of as well. So
exactly. Maybe right.
Happy to take care of them.
And then someone here asked about, okay, sorry, I have to ask, I hear as you age, it's not just the skin and muscle that changes, but the bone. What can we do to keep our facial bones healthier, if there is even an option for bone?
Well, that's a great point to understand, which is this volume loss that happens as you get older, and clearly that involves the soft tissues and the fat and the muscle, but it can certainly affect the bone. And by the way, I am really a big believer in holistic treatments. So, good nutrition, including calcium in your diet, vitamin D, all of that is really great for your bones. Obviously good exercise, good sleep. Good hydration, all of that is really stress relief. All of that is critical to just a healthy lifestyle, and so all of that is certainly useful. Don't smoke, the way that's
right.
Really bad for your bones and everything else for that matter. But there are things that we do though to address that bone loss that happens. No matter what, as you get older, unfortunately, you do lose some of that volume related to bone loss, and fillers are really one of the perfect solutions for that. So
even fillers.
Absolutely. So, part of the reason you lose some of that nice youthful fullness to your cheeks as you get older, we talk about this kind of a heart shape or a triangular shape you have to your face when you're young, which really becomes more of a square as you start to lose volume and things start to kind of fall down. And that's kind of a more of an aged look, right? You want to keep it up. Nice
please stay up, please.
Apple cheek. Right. So part of what we're looking to do again is we replace some of that volume with the fillers. Now, in the long term, I'm so sorry. In the long term, there are fillers that are actually made up of calcium, something called Radiesse, which you can actually use to replace some of that bone loss volume. I usually save that at the end if somebody's really happy with the way they're looking and they're looking for a little bit more of a kind of a longer lasting correction. Because the calcium is not reversible. Remember, we talked about most of the fillers I use are reversible. The
Right.
calcium is not. So you really have to be very happy with that look, and then we can certainly put that radius in there for you. And then ultimately, in the long term, if you're really looking for a permanent correction, there are implants that we can use. Obviously, implants for the chin, but cheeks and temples and other things that can certainly give you a permanent degree of correction. But that's an excellent point. You know, that bony framework is really what all of the soft tissues drape around. And so restoring that bony framework to the way it used to be is really an important part of what we need to achieve.
Love it. So informational. I love it. So going back to, you're talking about maintenance and like taking care of yourself from the outside too, right? So supplements, vitamin D, exercising, drinking lots of water. And that brings me to like topical treatments, right? What I have come to see Marissa for many times. Are these also important to keep up with? And like, why are they like, do we just need Botox, or should we do the occasional facial? Can we do like the microneedling, like the Morpheus 8 that I did, which I am absolutely in love with, that Marissa is like a pro at, and we're actually going to have a live with her later on in the month to talk about all these treatments. But is it important to do these?
Yeah, absolutely. You know, it really is a combination that really gives you the best result. And sometimes, the combination of one treatment and the next treatment, it's not like 1 and 1 is 2, it's more like 1 and 1 is 5, because the combination works so well to really enhance the ultimate result. And so you're absolutely right. So in addition to all of that stuff about good nutrition and good health and sleep and all of that other stuff, taking care of your skin is a critical component of what we're talking about. So being careful about the amount of sun that you get, because sun damage can really be, very cumulative over a period of time. So
You mean I can't wear baby oil out with iodine like we
the
used to in the
iodine,
80s?
the reflectors, right back in the day. No,
What were
so
we thinking?
right. And no, nobody unfortunately realized how bad it was. Everybody thought that the tan was a healthy thing, but now we realize, obviously, that that's not necessarily great. And there's plenty of spray tans, by the way, and plenty of ways to build up a base without having to put yourself through UV radiation tanning beds and the sun. Not that you can't go out in the sun, by the way. I love being out in the sun. But, just a little
Wear
sunscreen.
SPF.
Exactly. Simple things, and that way you can go and enjoy your beach day or, being out. Again, little simple things that you can do. But going back to the skincare, you're absolutely right. So there are things that you can do in terms of, a little exfoliation, which you need, certainly a little moisturization, certainly a little sunscreen. What I would recommend is that really everybody should have their skin analyzed. We have a great computer system called the Visia system that will look at your skin to see what's going on in terms of pore size and bacteria count, and lines and wrinkles and blood vessels in your skin, a whole bunch of different variables. And then based on that analysis, you can see exactly what's going on with the skin and how you're taking care of the skin compared to other people in the same age and skin type. And then based on that, you can figure out what's best for your skin. And that may be, a dermaplaning or microdermabrasion or facial or something like that to kind of buff up the skin. The Morpheus that you mentioned is a great way of tightening up the skin, rebuilding the collagen that you lose in your skin. Lots of little things that can be done. Photofacials are a great way to get rid of all of the pigment damage and blood vessels that may be bothering you. So lots of different treatment options that are available, and really the key is to see somebody like Marissa, who's an expert, who can sit down and do that analysis and really figure out a good game plan for your skin.
I can't stop talking about how much I love all the treatments I've gotten so far. I'm gonna be honest, the last time I had Botox was like 2 years ago. And, I've tried to well, first of all, it's very expensive, so it's hard to get it very often, right? But these treatments that I did that my husband so generously gifted to me for my birthday, and like this Morpheus that we'll talk about with Marissa, but I can't believe it was literally, it took a couple of weeks because, first you're like, you feel, you see the texture because it's like actual needles, and then the radio frequency. Marissa keeps telling, right? Yes. But the results are amazing, and I think that obviously I need a little Botox refresh. So once I can come and get that with you, it's gonna be like perfection. But I can't
You look,
believe.
you look great. You know, again, the Morpheus clearly is helping and will continue to help because you rebuild the collagen over a period of time, which is fantastic. But you know, again, like I said, you got to put all of the little pieces together, and then that overall look, it really is a nice natural look, a good way to maintain your skin. The issue about the cost is a good one, which is sometimes if you're good about setting up these maintenance treatments and kind of coming up with a game plan, then the costs actually become less over a period of time because the Botox will start to last a little longer if you're in a
Right.
maintenance routine. And so really the idea is you got to think about this and plan a little bit, and then
Yes.
that can certainly look your best, and obviously you're going to feel
It's
your best.
worth every penny. And do
You
you
got
guys have any kind of like membership rewards programs, things that you do, or is it just,
Well,
like
we do, you know, and we're such a high volume practice because, again, I've got my physician assistant, Ryan, who does a lot of these injectables as well. I do these injectables. Dr. Moskovitz, who's an eye plastic surgeon, does some of these treatments as well. So we've got enough providers that, you know, we are connected to these plans through Botox, for instance, through Allergan, where if you do a certain number of treatments, then you get a complimentary treatment, things like that. We obviously have specials, other things that we always run, and Marissa's
right?
kind of setting those up. So, you know, again, you got to kind of keep your eyes out for
Yep.
those. And you know, we also have financing and a lot of different options because we do want to make these treatments available and affordable. I mentioned my fellow from Mount Sinai. You know, if you have treatments now, he's great, by the way. He's got great hands. Remember, we talked about having good hands. He's got great hands. He's finishing up his training, but, you know, obviously, if you have a treatment with my fellow, then the treatments are a lot less expensive. So there are lots of different options in terms of what can be done through our practice to make sure we can get everybody taken care of.
But the fact that you're training him makes me feel so much better to go to him, right? If I wanted to save some money that month. But
You
like I
got it.
tell my husband, he likes snowmobiles, motorcycles. He likes all of his little toys, and this is my guilty pleasure, right? So that like, hello, we each get our own thing. So
I love it. Don't
that's
talk
what that's
about it.
exactly. So
Love
all
that
right,
comment. I mean, the thing is ideally, again, you want to look and feel your best. And we
exactly.
have a lot of men, by the way, that we take care of because it's all about, you know, that self-confidence that comes with looking and feeling your best.
My husband actually wants to come get a facial. So, because I gave him a facial one night, I'm not a certified esthetician, but I was just, massaging some skincare into his face, and he was like, "Is this what Marissa does to you?" And I'm like, "Uh huh." He's like, "I need to
Love
see
it.
Marissa too."
And is a little different from the girls. And so again, our estheticians know exactly what they're doing because it's very specific to the male skin and, you know, the needs that men have that may be a little bit different from women. And so again, I think having kind of a customized regimen that works well for you is really the best fit. So you want to go to somebody who does it on a regular basis so that they can take care of you.
And I love the personal consults. You've given me consults, and Marissa has given me consultations, and they really feel personalized, and they really feel, I feel special every time I come there, and I feel like you're doing what's best for me. I never feel like you're trying to just sell me a treatment ever. You've told me in the past, like, no, I don't think this is going to benefit you. You need to do this. And Marissa's done the same, like, no, I think we should do this. Like, this is what you're going to see the best results for your skin with this. And that's why I love your practice, because it just feels so genuine and authentic every time. Um,
Exactly, you know, again, the philosophy that I have, which is ultimately, I mean, again, we take care of so many people. It doesn't make any sense for us to be pushing things that don't work. You know, it's not a way to make patients happy. We want patients and clients to be happy with the result. And so recommending the treatments that will get them the results that they want, really, I think is the best philosophy. And, again, I agree. I think Marissa and everybody here at our office really buys into that concept that ultimately we want people looking and feeling great, and that's the best way of taking care of people and getting the word out.
and that's the same with makeup too. I don't like to push products onto people when I know they're not going to use them, or if it just doesn't fit into their lifestyle, or it's just not the right product. Just because you're supposed to sell, you're supposed to upsell something. No, if it's not going to work for them, I don't recommend it. And that's how you build that trust with people. And then they keep coming back to you. So little shameless plug for all my Mac artists in there. We just had a training about building trust, right, and clienteling. So I have to like put it in there.
Really, it's what it comes down to. You've got to have a good relationship, and you can't build a good relationship if you're trying to push things on people. It's got to be something that they want and something that they appreciate and something that will work for them, and then they'll be happy. And then again, then it all comes naturally after that.
Exactly. I love it. So we have one more question. We have about 10 minutes left. Okay, 10 minutes left. And then we will, so if you're just joining us, Dr. Abraham is going to give away one Botox treatment to one lucky viewer. He will help me choose at random at the end of the live. So once I save it and I will go through all of the viewers, we will contact you. Okay. And we will make sure that you know where to go and that way we'll, I will hook you up with Marissa, who will schedule you with the doctor to get that consult, your free treatment, and then who knows, maybe, you'll want to get something else. You never know, right? It's like going shopping. When you go shopping for a blouse, I never just come home with the blouse. I come home with the blouse, the pants, the shoes, the accessories, right? So last question is, there's this new trend that I heard about. It's called the hyaluronic pen. So it's basically, it's being advertised as no needle, like a non-needle kind of like lip filler. Have you heard about this? What do you think about it? Would you recommend that, or do you prefer the actual injectable for lip augmentation?
So Marissa and I were just talking about this because it certainly sounds like it's very new, and I haven't heard about it within professional circles. But the concept, I believe, is similar to something called a dermajet, which is a syringe essentially that we use to inject numbing medication. And the way it works is that it using kind of a high compression air, it kind of causes the product to get into the skin. So without a needle, it's kind of an interesting concept. You're forcing the product to get into the skin. Now, what I know about that, though, is that it's very, very superficial. So it gets into the very superficial parts, the very top layers of the skin. So I have some concerns about that treatment.
Please tell us.
Well, because again, typically where you put the filler isn't in the top layers of the skin. You want that filler to replace the volume, which is usually deeper down. Now, what Marissa was telling me about this product also is that it is done by people at their homes usually. And so I'm also a little concerned about what they may be injecting into their skin in that fashion, because if the product is FDA approved and if it's done in a physician's office, then you know what you're getting. But you hear about these horror stories about people injecting, I don't know, mineral oil and all kinds of shark
We've
cartilage.
heard, yes, so many horror stories, right?
Which can cause a lot of damage to your skin. So you have to really be a little careful. So if you're getting some sort of home kit that's promising you to be able to inject stuff into your skin, I would be a little leery. Now, there may be a role for this if it's done in the right fashion, and maybe it's a way of, I don't know, volumizing your skin a little bit by like kind of hydrating it with the hyaluronic acid. So if it's done safely and in the right fashion, and it is in fact hyaluronic acid, which is that nice natural product that's going into your skin, it may be okay. But I would do a little investigating. In fact, if there's a patient who's got some literature or something like that, that they want to forward to you or to me, I'd be happy to look into it a little bit more. But I have some concerns about the concept. It may be interesting and may be something that we can build on. But if it's just like a little home kit that you're supposed to try it by yourself, just be a little careful about what you're injecting into your skin.
Yeah, no thanks. I'm gonna come to you. It's okay. No worries about that. But who knows? It might become something that you offer someday from someone who's actually certified and has, maybe there'll be a course that they'll offer, or whatever the case may be. You just never know. But I would be wary too about going to someone's home, who I'm even worried about. You always hear this, like your dentist who can also do Botox. Like, I don't know, like, they might be okay, but I would rather go to a facial specialist, right? To a doctor who actually understands the face, the structure of the face, and who does surgeries. You know that even though it's not that intricate as a surgery, but still, like, this is your face. This is whatever, you know.
Yeah, so there's a lot of anatomy that goes along with the face, and I mentioned this before. Really, the bad things that could potentially happen if you don't know what you're doing is you could potentially put the filler into a blood vessel, and if it gets into a blood vessel, it's a problem. It really is a problem because that can cause the skin to break down, and God forbid, if it gets into your eye, things like that. You really have to be very, very careful. So you have to have a good understanding of the anatomy. Now, I don't want to necessarily paint dentists with a broad brush. By the way, there are certain
No,
oral surgeons who get extensive training, and if you go to the right oral surgeon
that's
who's
true.
the training and has the expertise, that may be okay. But clearly, if it's somebody who's just taken a course over a weekend and then is starting to inject without really understanding kind of the anatomy and having that experience, that training, and kind of the artistic eye, all those three elements are really critical. Then you have to have some reservations. And I'll tell you, one of the things you do have to be a little careful about, we talked about cost and maybe potentially having options within my practice that are reasonable in terms of cost, but you don't want to necessarily go to a person that is ridiculously cheap or much less than everybody else, because there's got to be something wrong in that equation. Why are they doing that treatment at that price unless they don't have the training or they don't have the expertise and they don't have the qualifications to be doing it? So just do your research. Again, there's plenty of people who can do these. It's not just me. There's lots of people who can do a great job, but make sure you put yourself in the right hands so that you don't have a problem. That's really the key, because they're very, very safe treatments. They're very reliable. They're excellent products, but you clearly don't want to be in a situation where you have some sort of a problem because it wasn't done right.
Yeah. Dr. Abraham, this was so enlightening. I'm so, so grateful for this hour with you. This is actually going to be saved on my feed forever. So I will be consistently sharing this over and over again, reminding everyone who maybe couldn't join tonight to view this. This is a really hot topic, and it will always be a hot topic. I think, it's who doesn't want to, it's like every man and woman's mission to like continue to look their best, right? That fountain of youth, that mission to find the fountain of youth. So this is going to be really, really informative. I love that we just went over all of these, like, really sometimes taboo topics, and a lot of misinformation is out there. So I'm so grateful for your time that you enlightened us on all of this.
Christina, can I do a quick shout out?
Yes.
I see that Anne Michelle Radcliffe is on. She is our hair specialist. So I left her name out in all of the specialists that I listed that are part of my practice. But Anne Michelle does a very special technique called scalp micropigmentation. I'm not sure if you're familiar with the concept.
I've heard.
If anybody's got thinning hair, I've got a little bit of that going on, so I'm going to be connecting with Anne Michelle at some point. It's a great way of kind of it's a tattoo that looks very, very natural, and it's a nice, simple solution to the problem. And she's also a hair specialist, so she does a lot of different things. In our practice, we also do something called PRP. You may be familiar with that.
Yes,
so
I've heard.
Rejuvenating and growing hair. And hair transplantation and other things that we do as well. But Anne Michelle is really the hair expert. So if you've got any hair-related questions or concerns, she's the person to talk to at my practice.
And Michelle Hair, that's her handle. Hi,
Yes.
Anne. So nice to meet you. Hopefully I'll meet her in person the next time I'm in. So thank you again, Dr. Abraham. I'm going to
giveaway, right?
Yes, we have the giveaway, but what I'm going to do is it's hard to pick someone here because we have to make sure what I do is I save my list of viewers, and then I'm going to input it into an app, and it's going to randomly select the winner. And then I'll let you guys know, and then you guys can contact them and do all of the rest of the good stuff. So thank you for whoever has been with us the entire time. You have to be following at New York, at NY Face MD to be chosen, right? Because that's the other thing. I have to make sure that they are also following, right, your handle. And you will get a free Botox treatment with Dr. Abraham and a consult for anything else. Like he said earlier, you go in and they basically just tell you what's going to be best for you, all of your options, And I tell you, it's the best thing that I have ever done for myself is to come to your Medi Spa, because it doesn't feel like a doctor's office. It's a Medi Spa. It's a beautiful, like you walk in and you hear this beautiful spa music, and it's just so, it's so beautiful. And like even the decor, like it's just gorgeous. So guys, you will continuously be hearing from me on my handle about all of my journeys with Dr. Abraham and Marissa, because I'm not done yet. And it's, you know, it's a great way for, you know, it's, how did you say, doctor? Like, it's the combination of everything. I sell makeup and skincare. Well, I train, really. I don't really sell it, but I work for a brand that has makeup and skincare, and you do all of the other treatments that together really make magic, right? So this collab totally makes sense.
Absolutely. It's putting all the pieces together and, you know, ultimately getting the best result that you can out of it. And really, again, having that quality, which is really, really important, and the expertise to be able to pull it together. And that's what you do with your makeup lines. I know that for a fact, especially since you're a trainer. And I think that's what we strive to do at my office, is just having all of the expertise so we can pull it all together and provide the clients and our patients really the best results that they can get.
I would not promote something on my handle, on my Instagram, or be behind something that I didn't actually think or know that it was top notch. And my husband will tell you that too. He always says I'm a little extra when it comes to that, but I don't care. Only the best, right? Only the best.
100%.
Only the best. Yes. So if you guys have been watching, this live will be saved as an IGTV. So it will forever be here. And I will periodically share it so that you guys, remind you that it's here. There's a lot of information that Dr. Abraham shared that is so, so important to know. A lot of myths have been debunked. We talked about it, all different types of treatments. You know, injectables was the main theme. No taboo here, no judgment here, judgment-free zone. If you want to look good and you feel good about doing something like that, go see Dr. Abraham and you know, his whole practice, and they will treat you literally like a queen, because that's how I felt. So thank you so much, Dr. Abraham. This was amazing. And maybe we can do another one next month or something. We can, you know, and if something new comes out, you know, a new type of filler, a new treatment, please call me. I will, if we want to go live again, we can tell the whole world again about this new treatment. I'm down anytime you want. And yeah, I can't wait to come see you in person as soon as it stops snowing forever here in this. Like, it feels like it's been snowing for 10 days straight.
I agree. I love it, Christina. This is awesome. I'd be happy to collaborate in the future. Thank you so much for putting this on. You know, again, it's great to have a chance to sit down and kind of talk about some of these topics and get that information out there. And nice to meet everybody virtually.
Yes, virtually. Yes. Thank you so much again. So I'm going to save this, and I will see my followers. I'll see you guys every day. And Dr. Abraham